Hi, it's Dr. Mayura, and I'm going to talk about high cholesterol. So, I'm sure all of us actually have heard about cholesterol and high cholesterol, also called as dyslipidemia. So, what is cholesterol? So, cholesterol is nothing but a fat, waxy, yellowish white substance which is present in the body. It's actually made entirely by the body, but there's some amount of cholesterol, about 20%, which you get exogenously from your diet. You can get it from dairy and animal products, etc. But all of your cholesterol is synthesized in the liver. So it's 1 gram per day. That's the amount of cholesterol that is synthesized in the liver. So you don't really need cholesterol from your diet. But so what happens is this cholesterol is good if it's in the normal amount. But if it becomes too much, it can go and clog the arteries and cause heart attack and stroke. If it clogs your coronary artery, it's going to cause heart attack. If it blocks your carotid artery, it can cause a stroke. Now, what is cholesterol used for? Right? What is the benefits? Why do we need cholesterol? So we obviously need it for a reason, because cholesterol it builds every cell in our body. So it's a structural backbone of our cells, the cell membrane of each cell. So it's very important. Also, cholesterol produces a lot of and helps in the production of a lot of hormones like estrogen and testosterone. Also, cholesterol is used in the synthesis of vitamin D, and cholesterol is also used to produce bile, which helps in digestion. So cholesterol is extremely important, but too much cholesterol, no, that's not good. So, what are the risk factors what are the risk factors for developing cholesterol? So the main risk factor is if you have a family history of cholesterol or heart disease. So if you have a father or mother or grandmother who had high cholesterol and heart disease, then you have to be extremely wary. Also, as you grow older, you are more prone to develop cholesterol, because your liver is not removing and detoxing the cholesterol from your body well. So smoking and alcohol, those lifestyle habits that you have also are leading to increased cholesterol. Smoking reduces the good cholesterol called HDL, and it also damages the vessel wall, which is allowing the cholesterol to sit there and form a plaque and then obstruct that arterial wall. So that's how the smoke harms the vessel integrity. Now, alcohol, of course, it has direct effects on the liver, and cholesterol is metabolized in the liver, synthesized in the liver. Now, there are a lot of, of course, a sedentary lifestyle. A sedentary lifestyle leads to weight gain, and obesity is a major risk factor. Over 30, if you have a BMI of over 30, then you have a major risk factor for high cholesterol and heart disease. Now, diabetes mellitus and hypertension are also risk factors for high cholesterol and heart disease. Now, PCOD, hypothyroid are also conditions where you have to be careful. Menopause, when a woman reaches menopause, she is more prone to developing high cholesterol. Also, women in pregnancy should go check their cholesterol levels. Now, they're also saying that people with chronic kidney disease and chronic inflammatory conditions are at risk for high cholesterol, as well as people taking drugs like corticosteroids or anabolic steroids or progestins. So there are so many risk factors that we need to be aware of. There are a lot of lifestyle risk factors and also things that possibly we can't control, like diseases. So these are the risk factors. Now, if you have these risk factors, you need to get your cholesterol checked very often. So you have to go to your doctor and start a regimented checking up of your cholesterol and also management. If you don't have these risk factors, then when do you check your cholesterol? So for children, you check the cholesterol once between 9 and 11 years old, and you check the cholesterol again between 17 and 19 years old. And that's it. So basically 2 times before you're the age of 18. And after that, you check the cholesterol about every 5 years if you have no risk factors. But if you do have these risk factors, then you will be checking your cholesterol much more often, and also be discussing with your doctor what measures you will use forward. Another risk factor which I didn't elaborate on is cholesterol is highly influenced by your diet. And by diet, I mean the fats that you're taking in. So there are fats called trans fats, like fats called saturated fats. And if you have an increase in both trans fats and saturated fats in your diet, then you're more likely to have high cholesterol. And so what are trans fats? Trans fats are all the junk food that you know, like your processed food, your fried food, cookies, French fries, frozen pizzas, you can doughy foods. So all of these are trans fats. Now saturated fats and trans fats are basically a byproduct of hydrogenation of fats from liquids to solids, and so that's bad. Most of trans fats are all bad. Saturated fats, on the other hand, also increase your risk of cholesterol. And saturated fats are the fatty cuts of maybe pork and beef and lamb, or you have lard, butter, full fat dairy. So all of these things are saturated fats. So you need to have a diet in high in unsaturated fats. So all of this contributes to an increase in your cholesterol. So keep in mind, diet is very, very important, and exercise as well. So when you exercise, you're increasing your good cholesterol, which is called HDL, and you're decreasing your bad cholesterol, which is called LDL. So I want to come into talking about things like LDL and HDL and triglycerides. You know, when you look at the cholesterol panel, you have this blood test you do when your doctor tells you to go get checked for cholesterol. And you come back and you say, okay, this is my total cholesterol. That says it's 250. This is my LDL. So all of these are written there. So what are they? So your cholesterol it comes in from your diet and your body, but it can't be transported in the bloodstream without being bound to a protein. So the cholesterol has to be bound to a protein, and it's called a lipoprotein. So all of these things like LDL and HDL are all lipoproteins. Now the fat as well. Fat is, you know, the major source of fat in your cells is triglyceride. So these triglycerides also need to be carried by something. So the triglycerides get carried by something called a chylomicron. So a chylomicron comes in and carries the triglycerides through the body, and it's kind of giving it to all the cells, and it goes back to the liver and it gets destroyed, and the remnants form something called VLDL. So VLDL is very low density lipoprotein, and so this carries some remnants of triglyceride and some cholesterol and cholesterol esters, and it's also trying to transport this to different cells in the body. Now once the level of triglycerides goes extremely low, it converts into LDL, which is called low density lipoprotein, and this is the bad cholesterol. This is the cholesterol we really want to keep low. Now HDL is high density lipoprotein. It's higher content of protein and lower content of cholesterol and triglycerides, whereas LDL has a very high content of cholesterol and less content of triglycerides and protein. So I hope you understood these terms. When you see it on your lab test, you should be able to kind of know what it means. So here we want so what are the ranges we want? So our total cholesterol under 200 is good. 200 to 240 is borderline high, and over 240 is high. Now your LDL, they always say keep it under 100. 100 to 130, if you don't have any risk factors for heart disease, then you're in a safe zone where you don't have to worry about it too much. 130 to 160 is borderline high, and 160 to 190 is high, and over 190 is very high. Now for triglycerides, under 150 is normal. 150 to 200 is borderline high. 200 and over 200 is high. 200 to 500 is high, but over 500 is very high. Now with triglycerides, you have to be very careful about pancreatitis. So if your triglycerides are shooting up to almost in the thousands or the 800, 900s, then you'd be worried about pancreatitis. So you have to act quite immediately for that. So so these are the factors that you see when you're looking at your test results. Now, so I've gone over what cholesterol is. I've gone over what the risk factors are for cholesterol. Now I've gone over what you see when you see a lab results and you're seeing those values there. What is this LDL? What is this HDL? What is this total cholesterol? And what is this triglycerides? Triglycerides is basically fat, which is going to the different cells in the body, nothing else. And your lipoproteins are basically cholesterol being transported to the other cells in the body in a protein component. So your LDL is called bad cholesterol and your HDL is called good cholesterol. Your HDL levels should be more than 60. If they're less than 40, then you have a high risk for cardiovascular disease. And this changes a little bit in women and men. So those are, you have to look at those values, research those values. So having high cholesterol doesn't really come with any symptoms. So there are no symptoms to look forward to. So it's your responsibility to go to the doctor if you have risk factors and get a checkup. And be be alert and get regular checkups of your cholesterol and modify your lifestyle. Now, what is the effect of cholesterol when you have too much cholesterol? As I said before, the cholesterol it blocks the arterial wall and it sits there and forms a plaque and obstructs blood flow, and therefore you can have a heart attack and stroke. You can have or the plaque can dislodge and it can completely go block the organ, and it can completely cause an infarction in the organ. So the treatment. Now I'm going to do the treatment, right? So the first thing is lifestyle. So your diet is very important. So you have to reduce your trans fats and saturated fats in your diet. So things like keto diet, they might not work in this because keto diet is known to increase cholesterol. So I always recommend having a nutritionist, because they can give you a very detailed meal plan of exactly the foods to eat and exactly the times to eat it, and be specific for your disease. And if not, please talk in detail to your doctor about what you can eat and what foods are required. Now, you also want to increase your fiber. You want to have fruits and vegetables, non-fat dairy, because you don't want the fat in the milk. So you like almond milk or fat-free milk. Also, you don't want to have the skin of meat. You want to have a lean meat like fish, for example. Fish is shown like 2 times a week. It's recommended to have fish. So you want to cut out a lot of butter and margarine and lard from your diet. So this is the diet you should follow. So you should also not indulge in smoking and alcohol. So you should reduce your alcohol intake and absolutely no smoking. You should also exercise about 30 minutes a day, every day. So this is also shown to in benefit by lowering your weight, your waist circumference, and lowering your cholesterol, and therefore preventing you from getting these cardiovascular risks and also metabolic syndrome. And it helps many other things as well. Now, some of the pharmacological interventions are statins. So statins, they are called HMG-CoA reductase inhibitors. So they interfere with the cholesterol production in the liver. So these are going to lower your cholesterol by 25 to 35% and decrease your risk for negative cardiovascular events. Now, statins can be, there's statins like atorvastatin, simvastatin, rosuvastatin. So all of these can be, you can talk to your doctor about them. Now, statin side effects sometimes are muscle pain and headache and nausea and dizziness. But some of the major side effects are rhabdomyolysis and myopathy. Also, they say it increases sugar levels a little bit, but that's not proven. They also say it interferes and increases liver enzymes a little bit. So those are not yet proven, but rhabdomyolysis is a main side effect of a statin. So you have to be careful about that. So the other drugs, the cholesterol absorption inhibitors, which prevent the absorption from the intestine so it doesn't go into the bloodstream. There are also drugs which are sequestrants. They're bile acid sequestrants. So they bind to the bile acids in the intestines and they prevent absorption of cholesterol into the bloodstream. There's also something called the PCSK9 inhibitor, which can also be used. Along with that, there's something called fibrates, which can be used to lower your triglycerides in specific. You can use niacin, which is a vitamin, which is shown to do that, is shown to reduce cholesterol. Omega-3 fatty acids are good to increase your HDL, which is a high density lipoprotein, which is a good cholesterol. So these are some of the drugs that can be used. There are more and more drugs coming out, and you should talk to your doctor about which one is suitable for you and whether you should start with lifestyle modifications or start a drug. So he will look at your ASCVD risk again, looking at that calculator which shows a 10-year risk of heart disease and stroke. By looking at your habits like smoking, your age, your sex, if you have diabetes, and your blood pressure. So looking at all of these things, he will make a decision of what intervention is good for you. I hope this helps. Thank you so much, and I'll see you soon.